Ma'am, so to begin with, can you describe yourself in a few words and tell us a bit about yourself?
Okay, my name is Mathew and I'm a professor of pathology at KMC Manipal. I'm also a student of KMC Manipal. I've done my MBBS, I've done my DCH and MD from the same institution.
Yes, ma'am.
And I'm happy to be a pathologist.
Ma'am, so I believe that you were a pediatrician before.
Yes, I did 2 years. Yes, I did 2 years of my pediatrics. I did a diploma in child health. I worked for 2 years in a private hospital, and then I got my MD in pathology. Yeah.
So how was this sudden transition from a clinical setting to a non-clinical one?
Actually, I wanted to move from a clinical to a non-clinical. There were only two subjects I liked when I was studying for medicine, and that was pediatrics and pathology. So what happened was, those days we used to get merit seats.
Yes.
So I got my merit seat first in diploma in child health, and then subsequently when I applied for my MD, I got pathology, so I shifted to pathology.
Ma'am, so with regards to pathology, can you tell us something about what you like about this particular specialty?
What I like especially is the fixed timings.
Okay.
Right? I didn't have that when I was doing pediatrics, and it's more of a teaching profession, but at the same time you're also a clinician because you contribute to the diagnosis of the patient. And I'd like to say a pathologist is always a consultant to a consultant.
So does it still does leaving out the clinical setting sort of still come back as regrets, or sort of like?
No, actually it has helped me because of my clinical experience.
Yes.
I'm able to correlate my biopsies with the patient's history and the symptoms, and I know exactly what is the diagnosis.
Yes. So what are the challenges of being a pathologist of this particular specialty?
Right now in India, I think we have a lot of people who are pathologists. You have to decide whether you need to be in a private setup or in a medical college. And in a medical college it is difficult because we have very few colleges for all the pathologists to compete. But it is quite, if you prefer private practice, it is good in terms of making money and providing services to the place around you, because that's what I tell my PGs. If you can make a difference in the village just by setting up a lab, that goes a long way. That takes care of at least the basic investigation of a patient. That is more than enough to get at least some sort of diagnosis.
Yes. Ma'am, so how were you interested in medicine, especially given that for most people in medicine it's either a choice or it's something for a few minorities, something which has been thrust upon them. So how do you say you entered medicine and this particular choice?
Actually, from the age of 8, I think I always wanted to be a doctor, because I remember I wrote an essay on Dr. Brand. I'm not sure if you've heard of him. He's the one who was pioneer of reconstructive surgery in leprosy. And he did a lot of work in CMC Vellore with the leprosy patients. So after that, I was very motivated to become a doctor. So my focus was always being a doctor. But after I finished my PUC, I didn't get medicine. So I started my bachelor's I did science for 2 years, and then I came into medicine.
Ma'am, so when you look back, what do you think are the absolute essential qualities you would want from, say, a budding pathologist or someone who perhaps wants to become a pathologist when they are in med school?
you have to absolutely want to do pathology, because most of the time students come to our department as a second choice because they do not get clinical subject or any other subject. And pathology is the closest that you can be to a clinical subject. So you have to love it, and you have to be dedicated, and you cannot afford to give a wrong diagnosis because it will cost the patient. Because when it comes to question of benign and malignant, if you give a diagnosis that is malignant and it is not, then may cost the patient's limb or an organ. So you have to be very careful. And these days the litigation is very high. Because in India before it was not a problem, but now doctors are being sued left and right. So the pathologists have to be extra careful when it comes to giving a diagnosis.
Ma'am, is the work itself very challenging?
Challenging as in because there's a lot of changes that's happening in pathology, because now we are moving into molecular and we are moving into genetics. Unfortunately, we are not able to catch up as a country, because now everything is patient-centered, genetic, and treatment is based on how you are going to respond. So that is a challenge we have, because we don't have that kind of money, or the patient doesn't have that kind of money to pay for such investigation. For example, if you were to talk about the BRCA gene for breast carcinoma, people can't afford it. You don't know whether you are, you're prone for getting carcinoma breast. Probably if you have a family history, you'll be, careful.
Sort of predict that.
But otherwise, we are still lagging behind in many ways, because medicine has not progressed or advanced in India, and it's much more expensive. It's very costly. The common man cannot afford it.
Ma'am, so how does, say, a place like Manipal, or how does any sort of pathologist come to terms with that and sort of try to progress towards a more molecular field, as you described it, by themselves or in their own personal efforts?
First and foremost, I think now we are moving towards it. A lot of young pathologists want to go in for high genetics and the molecular field. That's a good thing, but you have to be inclined for it, because you have to be research oriented. Unfortunately, in our country, we are not research oriented, and it's not that we lack the brains for it, but we are so focused on making back the money that we spent on our education, that
and especially in a private setting.
And even we are not taught how to do a research as a student, because there are students who love it, there are people who love it, but they are not able to do it. Once they become a doctor, there's no scope actually for research. So but we are okay. I mean, we're moving towards it. I hope maybe in 10-20 years time we'll be it'll be
a better situation.
Correct.
Ma'am, and what advice would you have for, say, for students in an undergraduate level, or for that matter in a postgraduate level, on, say, pursuing research and the importance of research as a whole?
You have to want to do research. And one thing we should remember, that if we think we have a brilliant idea, someone else has already done it. So we have to think beyond what is currently available. So that kind of far thinking should be there in a research. And of course you have to be very curious. You shouldn't accept things as they are, because what has happened now is we are taking much of our practice and treatment based on Western medicine, but we as Indians or the Asian population may have a different response to the treatment. So we need a lot of research even in our
more India-centric.
Yes, we need it for our own culture and our own country. So
especially something more economically effective.
Exactly. So actually we had a postgraduate who designed I think it was for FNAC, final aspiration, a very cheap innovative method of doing FNAC, and it's so. And why did he come up with that idea? Is because he was posted in. I mean, he's from Orissa, and the people there cannot afford even basic treatment. So you need to think in those lines, and you don't need really costly equipments to get. To
do a certain procedure.
Exactly. So it has to be indigenous for our own culture. That is what is important.
Especially with for SRF in Manipal itself, they were conducting this thing called a hackathon. Especially things like that could go a long way. Something.
The problem with the research is that we need funding, and we do not have funding. So, in India, it's only 2% of the budget that is allotted to healthcare. When that is not going to help at all. We need much more, money towards healthcare and research. And now, because of all the unethical clinical trials that has happened, now all those, the Supreme Court had to come in and intervene and say no more research. So it swings to the extreme. So we need some sort of,
moderation.
Ma'am,
can you recount a few cases, say through years of practice, through years of seeing a lot of different cases? Can you recount some very particular case you still remember till date?
I can tell you from Paediatrics, because that is where, we had a lot of. I remember I treated one child with leukemia when I was a postgraduate, and her father was a bank officer, and I still remember her name. Her name was Sharvari. So after I finished Paediatrics, and 2 years later, when I came back to do MD Pathology, and I was in the lab, in the hematology lab. The father was actually, he wasn't a bank officer, he was an army officer. The father actually came maybe 5 years down the line, and he gave me a wedding card. And she was disease free, and she had survived that leukemia, and she was doing very well. So that was actually, you feel, good that you're a doctor, that you're doing something, worth it. So those kind of experiences, the clinical experiences are really good. But the problem with doing pediatrics is you have to be emotionally strong, because you see that many number of children dying than living, especially because ours is a tertiary care center. We see a lot of leukemias and malignancies, and a lot of them cannot afford the treatment, and they die. So this kind of at least one child doing well, extremely well, is a good thing. It was a really, and I'm surprised that the father even traced me down, because he didn't know that I was actually in pathology, but he came to give, he knew that the lab was, he used to come frequently to the lab. Then he saw me, and he, 5 years down the line, he came and he met me and he said, "I need to give you this."
Ma'am, from that experience, how would you say, even in case of a pediatrician or in case of any doctor as such, what would you say is the ideal balance between being empathetic and being considerate of the patients and being a bit indifferent towards
you cannot afford to be indifferent as a doctor, but you cannot afford to be emotionally involved, because that professionally that will break you if you're emotionally involved with every patient. But you can be empathetic, and you can feel for the patient and do the right thing. But my advice is not to take it back home, because then it affects your family life, and so you have to maintain some distance between your professional life should be professional and personal should be totally separate. What happens as doctors is we sacrifice our family for our profession, for our professional life, and if you see, majority of the children of doctors don't want to be doctors, and this is the reason. So I think we have to strike a perfect balance. Otherwise,
even in fact, Naresh Trehan himself the founder of Medicity.
I think he's in Fortis.
Yeah, but he founded that Medicity.
Yeah.
So he came around and in an interview he was telling us about how he sacrificed, in fact he sacrificed his family life just to work on that particular project, and like he didn't even realize how both of his sons grew up and now they're subsequently in college themselves, and he barely has any sort of connection with them.
That's exactly what happens to us. If you're not able to separate your personal and professional life, it becomes very difficult.
Yeah.
But at the same time, there's sacrifice involved in this profession.
Yeah.
Sometimes you don't have a choice but to be on call, or but that you can take vacations too.
Yeah.
So it's up to the person actually.
Yeah, ma'am. So what are your views on, say, this present framework of medical practice and this sort of growing hostility towards doctors that is being rampant, especially among the public right now?
I'm not sure whether it's just a few doctors who spoil the name of the profession. Sometimes at some point you tend to be a little greedy.
Yeah.
So that is what is happening. And another thing is probably we've lost empathy. In the search for gaining knowledge, we have lost empathy for the patient. So that I think the studies have shown that 95% of the time, 97% of the time, litigation can be avoided if you communicate well with the patient. See, nobody wants to do harm to the patient. Everybody makes mistakes. And I think as doctors we have to admit that we made a mistake. And if you talk to the patient, see, patients come to you, why? Because they're already sick, they're down, they're depressed. If someone is kind to them, that actually enhances their healing. So all you have to do is just talk to them. You'll see that why are the most intelligent, high IQ, students who go out with medals, if you see they don't do well as doctors, why? And the person who's an average person will be having the most number of patients. Why is that? It's nothing to do with the knowledge. I mean, you need knowledge, of course. Yeah. But it is how you deal with your patient. You can be brilliant, but not necessarily a very empathetic doctor. And I think we've lost that. I'm overtaking medicine for what it was.
Especially the financial aspects of it.
Exactly. So,
how do you see it changing over time?
I have hope. I mean, I hope it will change. Because this is not like any other profession. It's not like being a lawyer or an engineer. We deal with human lives.
Yeah.
So we have to deal with it in a humane way. We have to be human. We can't, take that out from the profession.
Yeah.
So I don't know. Now we are trying. That's why we're bringing in back ethics, because.
Right.
It's unfortunate that we have to teach doctors how to behave when it was always understood, how doctors should behave.
I think a lot of that also has to do with the less timing and everything.
Less timing, as in?
A lot of medical students, as we see it, they don't have much time aside from just studying. And so they don't develop their other skills as well.
No, we did the same course. I'm a product of this institution. Nothing has changed. Everything is the same. I'm not sure why you're saying that it's only studying. We studied hard and played hard. So we've never. I have enjoyed my MBBS course, and we were the first IR. We were called the IR batch, the regular batch, because we only 40 students joined in January.
Yeah.
And the 40 first majority of us cleared together. We were like a unit.
Mm.
Of course, some were from the previous batch and all that, but 40 of us cleared together and we did very well. And we also had good times. We didn't, it's not like we sat in the library and studied. We did both. So I don't, because the syllabus hasn't changed in terms of number of hours, or maybe the information has changed, but nothing new has happened in terms of doing. In fact, our current dean is trying to give all of you holidays on Saturday. We didn't even have holiday as an half day every Saturday. We didn't even have that luxury. We had Saturday full day, but still we had no problems. So I don't think it's anything to do with studying. It's how you're going to balance your life.